we face our fears and anxiety. Coming up next, On Call with the Prairie Doc. I don't like spiders and snakes, or edges, or... Are you anxious about stress from your work or family life? Fear can be a powerful motivator, and anxiety can cause mental and physical conditions detrimental to our health. Dealing with fear and anxiety tonight on Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. 11,000 years ago, our ancestors were often exposed to fear and anxiety in their lives, dealing with an environment coming out of the last ice age and the dangerous animals that inhabited their world. We were not the top of the food chain back then. They found ways to cope, and as family and tribal groups, they found respite around the campfires. However, in many ways, today we encounter stresses and events that cause us fear and anxiety on a seemingly relentless level. Terrorism or Ebola, workplace conflict or finances, spiders or snakes. It just seems as though we cannot get away from the pressures of our modern lives, much of which we've created ourselves. To help us explore fears, anxieties, and the problems they cause are Dr. David Ermer with the Sanford Health Psychiatry and Psychology Clinic in Sioux Falls, and Dr. Matthew Stanley, who practices at Avera Medical Group, University Psychiatry Associates in Sioux Falls. Thank you both for joining us. We've got both colors, and you know, they're your deep enemies. I can see that right away.
We rode together.
Yeah.
You're driving.
It's going to be a rough ride home, right?
Yeah. So, Dr. Ermer, tell us a little bit about where you're from originally.
Went to medical school in Nebraska. And
Are you from Nebraska?
Yes.
Little town?
Small town in Nebraska.
So you were a ranch kid, or is a small town boy?
Father sold farm equipment, had a small farm.
You helped him on the farm, I suppose?
Helped more with the farm equipment.
That was a better deal than the farming, yeah. And then you went to medical school in Nebraska and did a residency.
Yes.
Where?
University of Kansas. Did my general psychiatry and child psychiatry at Kansas.
And then what brought you to Sioux Falls?
Just the opportunity to, a good job opportunity, frankly, and we've never regretted coming to South Dakota.
Yeah, so, and you're a child psychiatrist. What drew you into that?
You know, I liked working with children. I felt, you know, at some part, you know, and you could disagree, but there's something preventive about you maybe catching kids early in any sort of disease process. So there's something nice about maybe, in my mind, there's something preventive about working with kids. Maybe you could keep things from progressing to the point of major problems.
Make a huge long-term difference.
Yes.
As a geriatrician and on a hospice, it's a kind of a short-term thing.
Yes.
It's a different story.
Well, they're still valuable.
Well, it's every human being, you know. And Matt, you are from where originally?
Shenandoah, Iowa. So southwest Iowa, not far from Omaha in that area.
And then you came to SDSU to play football?
Yeah, that's what drew me here. My wife is from South Dakota. We met at SDSU, got married. I went back to Kansas City actually for first year residency and finished the rest of my general psych residence here with USD, South Dakota.
So and then you're a South Dakota boy and your family's here.
We've lived here ever since. I'm a transported South Dakota boy, but I am a South Dakota boy, and my children are all South Dakota.
Yeah, there you go. So there you are, and a football. Was that a good experience?
For the most part.
Did it make you want to go into psychiatry?
I don't know. I've often wondered if I'm the only former middle linebacker that's a psychiatrist.
Yeah, I bet you there aren't very many.
You don't remember from the...
Yeah, it's all that head
trauma.
trauma.
Not for the brain damage, it'd be, who knows.
So both of you have been here for a while, and you're the behavioral health hospital, you're the director? Or the medical director, or what's your position?
So, and we've changed titles a little bit. I'm the vice president of behavioral health now, so it's just part of a restructuring. But medical director there as well.
So do you do research too?
You know, we are not incredibly academic, but we do have our genetics research, and we're initiating a study in our lab right now to look at depression in particular, to see if doing some genetic testing before treatment will kind of smooth the course of treatment. It's mostly has to do with the CYP, the CYP system, and how we metabolize drugs. So one of the big debates is we can do a lot genetically now, but how much does it impact the course of care and the cost? If insurers are going to pay for it, we really need to be able to establish that there's a benefit to them to do the testing.
Right.
They're the ones paying for it. So that's a current study. So yes, we do some research.
Right. And we have a psych residency in Sioux Falls.
Correct.
So are you both involved with that?
Yes.
Yep.
See, there you
And
go.
we have a child fellowship. So the residency plus. So
That's really neat.
it's fantastic for here. And I think it's one of the reasons, although we're still in a relative shortage, we're not as hard hit as other rural areas because we're more or less developing our own.
It's huge to have a residency. I mean, it's a welcome addition to bring any residency to South Dakota because people tend to get comfortable with the health system and they tend to stay where they trained, and so it's been a real asset.
I mean, you look at the advantages of having medical school and residency programs in our state, and it is the huge benefit for the people of our state.
Absolutely.
Yeah.
So-
And we've tracked our residents. More than 60% stay in this area to practice. So that's
That's a
phenomenal.
great thing.
Yeah.
So the psychiatry, and you were talking about psychiatry residents, is what you were saying. 60%.
Correct. Yep.
Wow. So one of the things that we're talking about today has to do with this this panic attack, the stressors, the PTSD, for example, people who have phobias. Let's just start with that. Define what a phobia is, David.
Phobia is a specific fear. It's like it's a certain stimulus, like a spider. I think they mentioned in the intro, a spider or a snake. There's normal sort of fears that normal child. You expect a child to have stranger and separation anxiety up until around 2.5 years of age. That's a normal development, and so there's some ingrained, I think, phobias. I think spiders and snakes are pretty universal across a lot of cultures. But it becomes problematic for us when it interferes with your living.
I mean, that's the point, isn't it?
Right.
When it interferes with your normal living.
Yes.
That's when it becomes pathologic.
Right.
And you get, kind of in your intro to David, you kind of described all these things. So anxiety as an umbrella covers a lot of ground. So anxiety is a huge topic. And if we take it in the whole, it's probably the #1 biggest mental health issue because everybody has
Some anxiety.
some, when you include PTSD, OCD, specific
Generalized
phobias,
anxiety. Social anxiety, or social phobia is probably the #1 specific fear for adults.
Social phobia.
public speaking.
Public
Yeah.
speaking,
Which,
fear of
yeah.
embarrassing yourself in front of others.
Yeah, well, some of us do it all the time. And,
Yeah.
Oh, well.
Some people aren't insightful. They don't really.
So, but the question is, some people just fear going into a public place. I mean, not even public speaking. They just don't want to be in a public.
Well, agoraphobia. So is one of the diagnoses of that fear of being in a large open space or a public space or a line, and fear that you will be overcome with anxiety in a situation where you can't escape or where you'll be observed. And
some people can publicly speak, but they fear the ambiguous social situation, the cocktail party where you just have to mingle and they're afraid they're going to say something embarrassing. Whereas if they give a script, they can be the best actor. I think they say Johnny Carson was very much a shy person when it came to
A group.
But when he had a structure, a plan, he did fine.
what's interesting, Jerry Seinfeld just said, I think I relate to that autism diagnosis because he can. There's a guy who can get up and speak, but he says interactions are really awkward for me if you get me outside of that venue.
Now, are you saying that autism is related to this same thing?
I am not. I was just using Jerry Seinfeld as an example.
But I would say there, especially with high-functioning autism, social anxiety can be a very big part of that. But they're two separate issues.
Right. Now, I mean, for many years, people, and people who are in the primary care realm have treated anxiety with benzodiazepines. Now, and I have a personal opinion, and maybe I'm kind of, like anything, you see it and you can't let go of the major point, but I think that's a cover-up, and many times it prevents people from being able to go forward with discovering what it is that they're afraid of and to work it out.
Well, let me put it in this context. I would say the same thing about opioid pain relief. So, but you have to treat someone to get them functional enough to recover. And I think that's one of the reasons we use opioids in acute pain. The question is, and the evidence is still not very powerful, that there's a benefit in chronic pain. So I think that with both of those medications, they have their place, but you have to be conscious of the risk and the patient has to be conscious of the risk when you enter into that treatment. And it probably should be a time-limited treatment plan, and it probably should have a concurrent talk therapy or growth aspect to it.
Right. The benzos, for example, all the old Valiums, the Ativans, Xanax, God.
I cringe when it's
because they get caught on it and you can't get off of it, and it isn't a time-limited problem. It's once they're on it, you can't end it.
Well, the problem is you feel very good. I mean, people describe feeling great when that initial hit.
First time.
It's a very good feeling, and and I think the anxiety disorders as a whole have probably some of the strongest evidence that talk therapy can be incredibly beneficial, and especially in the world of child and adolescent. I'm very much against benzos, except in the extreme circumstances. We would definitely start with talk therapy if we can.
It reduces memory. It puts people sometimes depressed. It makes them depressed.
Mea culpa, though, I'll have to say that I have had people that are on benzodiazepines over long term, and you just have to be aware of, as you said, what can go wrong, and you have to manage that.
And sometimes you can't stop it. So you live with a certain dose, but you don't go up.
Well, and you have to set limits. You have to have a good relationship with the patient.
Yeah. Many of us have something that makes us react with fear or anxiety at the very mention or sight of it. We sent a crew out to discover some of those phobias. They stopped at the Children's Museum here in Brookings one morning during a weekly gathering called 1 Million Cups.
Sharks because I saw Jaws when I was probably too little, and heights because I don't want to fall.
What bothers me is getting older and just kind of the aches and pains associated with that. Not maybe getting older in general, but a pain here or there, what it means, what it doesn't mean. I just turned 30 this year, so for the longest time it was something where you just kind of waited or rub a little dirt on it or see if it passes. But now as I get older, it's one of those things where I start thinking to myself, do I need to go to a doctor?
I'm kind of scared of like tall roller coaster type, and tall bridges, things like that, because sometimes I'll have dreams that I'll fall off or go over a cliff and fall off.
Also, mouse. I know they're smaller than I am, but it's just the thought of jumping on me, I guess, I don't know. So that's what I fear the most.
I grew up West River, and my grandparents lived down on a ranch, and snakes scare me to death. So much that I can't even really watch snakes on television.
I am afraid of going down an escalator without someone in front of me. I need to have someone in front of me, or I feel like I'm falling forward. Going up doesn't bother me a bit. I can do that. But going down, I feel like I'm going to fall going down that escalator.
I'm just scared to death of spiders, and I do not have any clue. No idea. I just hate them. Everything else, scorpions, could care less, snakes, nothing else bothers me in the least. But spiders, I hate them.
So we let the Children's Museum know here, 6:30.
Well, I thought that was really kind of fun, and it wasn't hard to find some people who said that they have their own personal phobias, as we all do.
And I think that's why they're so comfortable talking about them, because they know they're not unique. They know that we've all got these, so they're willing to share.
So what is your phobia?
Well, I might be unique in that I don't. No, I would probably qualify with snakes, sometimes height. I don't know.
Yeah.
Other than that,
I don't know.
Spiders bug me. Snakes could care less. We used to catch snakes when we were little and bring them in the house, but spiders, forget it. I hate them.
Yeah, it used to be that when I was in an airplane, it would, bump. I would just turn right into a jelly, but I kind of got used to it. I don't know. I think standing up and preparing, giving a talk, sometimes scares me a little bit.
Well, it can very much. I would say if I'm prepared, so there is that whole planning aspect of it. If I can prepare for it, I'm good. If I know that I'm not fully prepared.
Well, it's a two-way street, actually. Anxiety typically is helpful at a mild level to help you worry enough about your talk to go out of your way to really prepare for it. So even in a sporting event or any sort of function, a little bit of anxiety is good.
Yeah. We were talking about this all week, and our producer said to me, that little bit of something's not right, that jangle of your nerves when you're talking with somebody who might be doing something wrong or might be lying to you or there's something wrong, don't know, and I'm getting that little bit of something that's frightening me a little bit, and you can't explain it. And that might be a very good thing. All of that can be very good.
I always tell the residents, pay attention to that and use that reflection of the interaction. So you can't base everything on it, but often there is a metacommunication occurring that isn't rising to the conscious level, but subconsciously you're aware of something. As you said, a tickler that says, yeah, not quite right here.
Well, you know, they've done experiments where they flash a scary face, and people, it's so quick that they aren't aware that that was done to them, but their limbic system kicks in and creates a fear response. So there is sort of this, you know, people call it the sixth sense. It really isn't. It's basically a feeling you get before it becomes conscious, or if it never becomes conscious.
If it ever does. So let's talk about limbic system and the amygdala. What is it, and why is it there?
Why is it there? Well, I think it is part of our reptilian brain. So it's part of our earliest development. And the limbic system, you know, is really kind of the seat of the emotions. The amygdala, probably more of our fight or flight response. So, you know, they are in that early kind of the core of the onion of the developing brain. And as you said, I mean, they came. I think they were developed for survival reasons.
Fight or flight. What's that?
Well, it is that response you have. So, and here's an interesting thought. So we kind of use anxiety and fear interchangeably. Fear, though, if we look at the definition a little more so, and it's a little specious maybe, but fear is of a specific threat, where anxiety is more of a kind of nebulous.
Don't know what I'm afraid of.
Might have a little concept, but it's.
A lot of times it's an apprehension, a vague feeling of discomfort. Not even vague, it can be a very discomforting feeling, but you can't say this is why I'm afraid.
Yeah, I have no idea, but I'm overwhelmed with anxiety right now about something.
So and so fear is when the amygdala kicks in, and that could be something, you know, like a 2-ton rhino charging at you, and you better have a very quick physiologic response and get the heck out of the way. Yeah. So that kicks in the, you know, the
adrenal gland.
The adrenal glands, the corticotropins, and you respond very quickly. Blood pressure, you know, everything from the vessels to the eyes to everything responds to make your body more effective at either fighting or running away.
Right. You have more blood flow to your muscles. You have a faster heart rate. I mean, everything says ready to fight.
And later signals get kicked up to your cortex, and you can think about what just happened, and you know, and then you process it. If you're at a movie theater, hey, this is just a movie, I'm okay.
Yeah.
or like the guy who saw the shark, he might say, hey, this is a shark in an aquarium, I'm okay. But your initial response might be to jump.
Yeah.
And then you think about, okay, I'm okay.
So here we are. Boat is anchored off a reef. Actually, we're tied to a ball. And the family's together. We're not too far from Miami. We're sailing down the Keys, right? And so we're going to snorkel. And so we're in a beautiful spot, and here's these wonderful reefs to snorkel off of. And so the 14-year-old boy and the 18-year-old boy, well, no, I think it was a 12-year-old and a 15-year-old boy. Anyway, they're in the water. And the front runner was out ahead, and he saw what he thought was a barracuda. Well, he panicked, right? And he turned around, and he started thrashing back to the boat. Well, the second kid didn't see anything, but he just absolutely panicked. It was just, I just watched fear overwhelm two little kids, and I'll never forget it. I mean, it was one of those, and of course they clambered back on the boat, and everybody's fine, and we didn't. I went out and snorkeled and proved that it's okay and we're safe. And
you know, interesting concept, because some of the studies with, you know, what causes anxiety in kids is, you know, there's some temperamental traits like inhibition, social withdrawal.
Yeah.
And coupled with parental anxiety, those two things are like a double whammy. So you get a very anxious parent, and whether it's a learned response or whatever, I mean, seeing somebody else get anxious as a kid raises your anxiety.
Well, and then of course, then you fear that they'll never get back in the water, so you try to bring them you know,
Right.
we're okay.
But if you were a really anxious person, you'd be screaming too about the barracuda and drag your kids in and leave the reef.
Yeah, and they'll never snorkel again, which would have been a sad story. Well, we talked about drugs. What can we do to help somebody who has an inappropriate anxiety? I mean, there's so much that it keeps them from doing normal function. I mean, what behavioral therapies are out there?
So behaviorally, one of the most effective treatments for almost any kind of anxiety, whether it's a specific phobia or what have you, is cognitive behavioral therapy.
Cognitive meaning think therapy.
Right. So it is. It's a lot about just walking you through, where your thinking is not matching up with the reality of the situation, where you have distortions and misperceptions, and then kind of teaching you to address those in different pathways, different ways of thinking. So it's a very kind of structured, almost teachable way. Yeah, rather than what people think of as psychiatrists, like, well, how does that make you feel? It's really more about if this, then this, kind of stepwise. Right. So very much like the lessons we learned in school. There's a pattern to it. There's homework to it. And a lot of people really appreciate that approach.
Right.
I think it empowers them. They really feel like they now have tools with which to work.
I've heard that in some people's cases, they, for example, a guy who was afraid of driving, and now that he's gone through all of that, he really, to settle himself down, he'll go out and drive around because he's got out of it, he's in control. It gives him a sense of that he's been able, empowerment, I think.
When they talk about that with rock climbers, a lot of those people describe having a fear of heights when they're younger, and they thought, I'm going to work on this and get over it. And it's almost like a thrill to them now.
Which is another kind of therapy, exposure therapy.
Right.
So
exposing them to it a little at a time.
Which is probably the most effective for some of the specific phobias. Right. So if you have a fear of snakes, it's a gradually exposing you to that stimulus, that thing that scares you, and until you build up a comfort level or at least a tolerance for that frightening thing.
Right. We had an ex-pilot in Kansas City when I trained. He was also a psychologist, and he was a fear of flying class. And it's a pretty detrimental fear for especially some business executives. And his graduation was flying from Kansas City to St. Louis and back.
Yeah.
But the point being, he's exposing them to their biggest fear and helping them work through that and realize that, hey, I can conquer this.
And it helps them get back to function, because the function that they have is having to travel a lot if you're in business.
Right.
Right, which wouldn't be a problem if you're a farmer who never lands to leave, but as you said, it becomes pathologic when it impairs your ability to function in your job.
There you go. All right. Pressure from exams, living in a new place, and no longer having the comfort of parents are all situations that can cause stress and anxiety in the lives of college students. The counseling services on campus do what they can to make campus life a bit more bearable.
Well, we try to use evidence-based techniques. So we try to look at what's triggering the anxiety, maybe, and reframe some of their distorted or negative thoughts that are causing it through therapy. We may give them some homework, in terms of to try to change their behavior and to notice when they're anxious. And if we need to, we will refer to Brenda's side of the house, and she will look at whether medication may be needed. We're also working on trying to get them to slow down and either take some time for themselves, maybe meditation, in terms of looking at what works for them to calm them down.
I teach them really on the spot, 1-minute meditations. Just let's do a minute meditation. Do you know how to do deep breathing? And they don't. Most of the time they'll say, well, I don't know what you mean. So a lot of times it's just making them stop, be present, close your eyes, and do a minute meditation. I talk them through that so they can do it if they're at the library, if they're about to take an exam, if they're in their car and they can stop their car. I really think that is so meaningful. And really, truly, meds are the last resort.
Being in the Wellness Center is so vital to what we do with students, because we have a dietitian, who can work with nutrition, and we definitely recommend exercise as a regular coping mechanism for anxiety and depression, and so we have that facility here as well. So we like the comprehensive nature and the care that we can give.
And those healthy lifestyle things that we do for all prevention of illnesses are so important. Good nutrition, like Darcy mentioned, adequate sleep. Sleep is a huge issue for college students. So we try to help them promote healthy ways to sleep. Exercise, getting outside nature. Nature is very connecting for many people, kind of even in a spiritual, meditative sense. So a lot of times, a day like today when it's very cold out, it's hard for people to do that. But they need to find things that they enjoy and to get it in that quiet space away from all the anxiety, stress, noise that we hear, in our heads sometimes. And I think just also having the intention to be positive makes a big difference too. So I think it really is about healthy lifestyle.
I think that not sleeping for maybe 3 nights in a row is generally a sign that you should get help. There's usually like a lack of concentration, whether it be when they're trying to do homework or in class. And also mood swings are a warning sign as well.
And the other thing I think that goes with that, I totally agree with those, and where someone just really can't function. They just really, their head gets so full of this stress and anxiety that they get to a point where they can't think straight, they can't get themselves to class, they're tearful, they don't, their heart, they might be having physical symptoms where they have like heart pounding, clammy hands, and they just really don't know what to do. So I think that's really, to me, crisis time with that anxiety.
Just that we're here, we're available. We try to incorporate like all facets of wellness and work, to find a balanced life.
And I think just to remember, it's so simple. We can all take a moment to do some deep breathing and meditation, no matter where we are. And it can be just as simple as that, just to remember to breathe. And so I guess I would say that's my personal 1 minute, quick thing to help you cope with your anxiety and stress.
We're back talking with Doctors Ermer and Stanley, and we're talking about stresses and anxieties and phobias and fears, and we just learned about campus life fears. What do you think, some would say you've escaped family, now you're in the circle of friends and life is easy as a campus. What do you think about campus life?
I think when we say that, we forget what it was like to be that age.
I was absolutely blown out of the saddle.
It is a time of so many transitions, and so much is undecided and indefinite. It is a great time of opportunity, and you form some wonderful, so there's the positive side, but I think we tend to forget how much anxiety goes along with that phase of life.
Right. Your thought?
Well, I agree. I think everyone wants to have this freedom. It reminds me of the Simpsons episode where the big bully, there were no parents around. He goes outside and he starts crying. Oh my gosh, there's nobody here to help me anymore. You go to college, you want to get free, but all of a sudden, who's going to back me? Who has my back? And today, I think social media makes it worse, because then you got access to all these people who seem to be having a great time. They never post, hey, I'm having a boring day in the dorm tonight, just going to clean the bathroom or something. Then you feel like you're not. There's just all these other stressors that are even bigger today, I think, than when we were in college.
Yeah, social media is a concept that we are only just learning about. And there's probably supportive factors of that, too. You have a connection to home, you can Skype, and some of those things maybe are beneficial with that transition. But I think the pressure to do well in school, the pressure to determine what your future is going to be, and then you have all kinds of new things, the peer pressure that's different without parents to return to. The culture on campus, and it varies by campus a little bit, but again, the alcohol use, the substance use.
I don't think kids at that age are really friendly. I mean, they can be, and it reflects, I think, their maturity. But I think they're still at the everything is all about me. In fact, everything is all about me now because I don't have any support until you get to a certain part of your life where you can realize that it's about everybody else. I mean, and you're living in among that group of people who are all stressed to the max. I mean,
that was one of our courses, normal adolescent narcissism. It's about me. And so, when parents, complain that their child isn't thankful for what they've got, I go, yep, well, good news, normal development.
Yeah. Well, I mean, you look at the kids who are very frustrated that when they're 3s and 4s and or terrible twos. They're just crying and they're very anxious because they're trying to develop their self. Well, they're in a phase of that early development. And it's hard as a parent to say, well, that's acceptable. Because they're angry, the kids are angry, it makes the parent angry.
But in college too, though, you also deal with maybe maintaining your own sphere, because there's a fragile ego too, and they're very afraid of rejection or judgment. So, you know, anytime you put yourself out there, you do have a risk of rejection.
Yes, you do.
And so there's a little bit of that too, kind of living in an emotional bubble, you know, trying not to open yourself up to those things. So there are the different types, different temperaments. Temperament actually is a powerful thing throughout our maturing process.
So what would you say to a college kid to reduce the stress? I mean, you know, you want them to perform, you want them to work and get their schoolwork done mostly, and then you want them to develop friends and connections. But how do you get
I don't know
past
the
it?
best way to say it, and so as I'm both a parent and a physician, and I probably have mucked this one up more often than I've done it well. But one of the things that I try to tell them is, you know, life is a marathon, it's not a sprint. What seems to be overwhelmingly unconquerable or incredibly discouraging now, if you put it in the context of the next 30 years, you will recover, you will rebound. Be resilient. No matter what happens, if you just keep getting up and stay confident that you will get through, that there is an end to anything that's difficult for you now, you will succeed. Resiliency.
I have never, will ever forget a phone call from my parents when my grades weren't very good the first halfway through the first semester, because I was doing way too much. I mean, it wasn't like being in DeSmet where you can be in everything. You know, you got to concentrate. And they say, well, now who decided they were going to go to medical school? Who picked that up? And I said, well, I did. I was the one. Now, your mom and dad supported you, but we didn't say that. You said that, right? So, but if we just keep us informed of what you decide, do what you want to do. We're behind you 100%. Holy Toledo, the burden of the world was off my shoulders. And just knowing that I was loved, which I think is one way.
That is absolutely it.
And supported.
That's the other advice I tell parents is you can make a lot of mistakes as a parent. We all do.
We do.
But if you let your kids know you love them, the margin for error just widens tremendously.
Well, no, I think that unconditional support, I can be disappointed in maybe some things that happen, but unconditionally, I'm there for you. And there's a term, actually, at University of Iowa, a professor, an old child psychiatrist said, good enough parenting.
Good enough.
Good, but what he's saying is, you know, you're going to make mistakes and you're going to screw up now and then as a parent. But as long as you're healthy and you have that support and stuff, you're going to do okay.
All right. Well, so let's talk about this issue of Ebola, which is right now causing a lot of anxiety in our country, let alone in Africa. Comments?
Well, I think it's kind of the mother of all fears, an unknown, overpowering illness that we're defenseless against. At least that's the perception.
With a kind of, it sounds like a very painful way. I mean, it's hemorrhagic fever. You bleed.
Yeah.
You know, it sounds horrible. I think there's only been, you know, there's only been, I think, one death in the U.S.
Maybe two.
Yeah. So it's certainly, the fears are, I mean, it's appropriate to be concerned about Ebola, but the fears certainly are way out of proportion.
There's more deaths from the measles that's resurging right now than there is from Ebola, but people don't seem to be frightened enough to get the vaccination that you could have.
But it is interesting, I think, that we're a very educated populace, and we understand that these super viruses, we don't always have the technology to beat some of what Mother Nature can throw at us. Right. And so I think that there is that fear that something, and I think there's a fairly legitimate fear too that something man-made, the bioweapon. So I think all this is rolled into this, that vulnerability, that mortality, that inability to control your own fate.
Right. Well, and they say that the next epidemic is not a will there be, it's when there will be.
Right.
And we have to be prepared for that, and the worst enemy would be panic.
Correct.
There you have it.
So there are fears. Now they're probably overblown, but as you said, I mean, something will happen. I mean, that's history tells us that, if nothing else.
Yeah, if nothing else. After dealing with anxiety and depression for a decade, one Volga resident has developed the skills to help keep her stress and anxiety levels low.
I think the first time that I ever started to wonder if maybe I wasn't reacting to stress in an appropriate way was in high school. I went to see a professional and was diagnosed with anxiety and depression and told I could treat it with medication if I wanted to. But at the time, I felt that there's so much going on in high school and when you're a teenager that I thought I would see if maybe, I grew out of it. So I waited quite a while, I'd say maybe until I was 22 or 23, and I decided that maybe it hadn't really gone away. It wasn't really getting a lot better, not especially worse, but I felt there's maybe something that I could do to not feel the way that I was feeling. What I really needed was for my emotions to kind of, be a little more in control. I will admit when you're on medication, you maybe don't feel quite as fully as you may remember feeling. Everything's a little bit toned down. But on the other hand, when you're presented with a really stressful situation, you're a little more mellowed out, so to speak. And so it can be easier to deal with that situation as long as you're making good decisions and trying to change how you react to these situations that trigger your anxiety or your depression. I do feel over a decade later that I have my anxiety and depression under control, or at least very, very manageable. I recently did decide to stop taking my medication, slowly weaned myself off of it. And there were times that I noticed in the first month that, something might, start to kind of trigger where I might react a little bit, overreact really. And so I had to, take a moment and recognize that that was how I was feeling and that this was an opportunity for me to use the skills that I hope that I've developed over the last decade in trying to deal with my anxiety and the way that I react to certain things that I consider to be stressful situations. Even though I've stopped taking my medication for anxiety and depression, I'm aware that I still have my triggers that will cause me to hunch up in my shoulders or to grind my teeth. And so I do have little reminders, like to check my posture, make sure that I'm sitting up straight, make sure that I'm relaxed in my jaw, because if I clench my jaw then I end up getting a headache later in the day. And so I know that I still need to keep these kinds of things in mind. I still need to work at keeping my stress level low, even though I've decided that I don't want to use medication anymore, to treat my anxiety and depression. To someone who thinks that they might be suffering from anxiety or depression, I would just encourage them to talk to their medical care provider, sit down and have a chat and find out what's really going on.
Thank you, Emily, for that, and just laying out the story and trying to get off of medications and so on. If we talk about medications, one of the things that I've thought is best in treating people who have anxiety are the SSRIs, which are quote-unquote used for depression more than the benzodiazepines, the Valium-like medicines that are quote-unquote anti-anxiety. What about the use of SSRIs for
Yeah, no, you hit it, Rick. So antidepressant is almost a misnomer because the SSRIs, the antidepressants, as they're called, actually are first line for a number of illnesses, particularly in the anxiety spectrum. And in broad, everything from OCD to PTSD, these have a broad application for anxiety, but generalized anxiety, even panic disorder, and even go further back, the tricyclics.
Right.
So an earlier
version of
antidepressants, yeah.
So what about kids with stress, this kind of a thing?
SSRIs are, if you have to, certainly you want to try some therapeutic approach, but SSRIs are the first line.
What are SSRIs? Just explain them.
They're serotonin reuptake inhibitors. Basically, they increase serotonin in your brain. Prozac, Zoloft would be the common trade names people probably have heard of.
And they don't make they don't take the serotonin and put it in there. They just keep it from being broken down. So I mean, you're not getting an artificial serotonin.
Right. And it's not an immediate response, so it's just not as magical as let's increase your serotonin in the brain. It's more complicated than that because some of these medicines can take weeks to work.
Yeah, there has to be a downstream effect and that speaks to the complexity of the brain and some of these illnesses, because you will change the synaptic level. So in between two neurons, that level of serotonin will change relatively quickly, but the therapeutic effect is weeks behind.
Right.
So think of SSRIs as if you have these two synapses, serotonin floats around here, it's sucked out of there by a vacuum-like thing. SSRIs block that vacuum. So instead of sucking serotonin out, it sits in there until it hits a receptor on the other neuron.
So it charges the serotonin receptors. I mean, it enhances the serotonin neurotransmitter effect.
Yep.
And that seems to bring people out of a funk, but it also helps people with anger control, and I think it's just one of the first things to do for people who have severe anxiety, stresses.
Yeah, absolutely. And Dr. Irmer touched on too, there's also some good therapies to empower people. We've already talked a little bit about cognitive behavioral therapy and exposure therapy, but anxiety disorders are so broad, you don't want to purely or solely rely on medications. So this is where I think talk therapy probably has one of its biggest benefits.
All right, so I'm going to come, one of my baby soapbox issues. My own down kind of a stressor kind of a thing is self-treated with exercise. Mm-hmm. I am truly a much better person after if I'm regularly exercising. If I have to stop because of something, I get into a funk. What do you think about exercise?
There's absolutely no study that doesn't indicate exercise doesn't help, whether it's depression or anxiety.
Say that was a double negative. Say that in another way.
I would say every study indicates that exercise helps with depression and anxiety. So I'd say it's unquestionably beneficial.
Well, I saw a broader spectrum statement. It said there's one thing you can tell your patients to do that almost exclusively is going to help whatever they have going on, and that would be
an exercise program.
Yeah.
So do you suggest anything in particular? Depends upon the age of the person, I suppose.
There's individual. I think it's got to be something they are going to stick with and enjoy. If you don't like to swim, I wouldn't prescribe a swimming program.
Yeah.
Good treatment plans are individualized, so you kind of meet the patient where they're at, and sometimes probably to our detriment we misinterpret their willingness to do things. But it's also
I think you're right. I think we
should probably make that a universal recommendation. But there's also things like sleep and wake structure, the sleep hygiene. So there are
caffeine use.
Yeah, there you go.
There are a number of things that we should probably standardize and be more consistent about our recommendations.
Maybe we can talk about sleep a little bit. If a lot of people will get prescribed a sleeping pill, most of the time it's amlodipine. What is your sense? I try to stay away from that, and I go in the direction of an antidepressant because it seems to long-term a better effect. What is your take on that?
Well, there are antidepressants that do very well in helping to induce sleep. Trazodone is really commonly used. Doxepin is often used as well. So, I think when you see some depression and anxiety as a component of it, you probably get a little more bang for your buck if you're going to use a medicine for sleep anyway.
Yeah. And how often is depression a component of sleeplessness or anxiety a component of sleeplessness?
Oh, it's exceedingly common, yeah, exceedingly common.
Yeah.
Whereas we were saying pain is one of the most common reasons people see a physician, period. Sleep is probably one of the most common reasons people see an adult psychiatrist. So,
just to get on my soapbox, especially with children and adolescents, with sleep hygiene is this fancy word, means what are you doing at night when you're preparing for bed? When you have a TV screen going with a video game and your iPad going, that is poor sleep hygiene. So I'm sleep experts are a big fan. You need to structure your sleep so you're setting yourself up to sleep well. And that's probably the first step, even for adults. You shouldn't be doing your work. For kids, there's one thing you should do in bed, sleep. For adults, maybe a couple things you do. But the point is you don't want to be doing your work from bed because there's a real psychological response. It should be reflexive. You see your bed, you think sleep, not think I'm working on my taxes or something.
Right, no. would not let me sleep. Or maybe it would immediately put me to sleep. I read an old neurology or psychiatry text. I mean, that'll put you to sleep.
That psychiatry stuff's stimulating.
Oh, yeah. So, but really, part of the question I would have is, you know, I know we've talked about the biochemical reason, you know, the adrenaline excess and the feelings of so much adrenaline makes you shaky and your heart pound and it's a feeling of stress. But is it because, is it the environment, or is it the genetics, or is it both? And what kind of environment can we do to help our children not be adults that are stressed out and anxious?
Well, when we talk about that kind of adrenaline overload like you were describing, I mean, that's essentially what happens in post-traumatic stress. So that is, there was an event that hardwired this elevated level of anticipation and anxiety that flares up or is consistent when it shouldn't be. So even though we can talk about trying to train ourselves to be more relaxed and calm, intense exposure can basically create tracks of that are very difficult to ameliorate once they've been laid down.
Tracks in your brain, a memory that automatically gets triggered, and then suddenly your adrenaline hits the roof.
Triggered by a sight, a sound, a smell, things that you wouldn't anticipate or expect to trigger that intense response. But that's not really what your question was. I think it was more about how we can work with
But
that.
isn't it the same thing, only in a minor way?
Well, there's two different things. I think the trauma is a big deal, because I think when people think of post-traumatic stress disorder, they think of Vietnam, they think of, you know, Iraq, but kids are exposed to, I mean, domestic violence is a very common cause of post-traumatic stress disorder in kids. So, you know, obviously giving kids a safe environment to grow up is paramount. But in addition, if you're just talking about, there's a good study just talking about more, what I call more generalized anxiety. If you identify kids with kind of a social withdrawal, shyness, and kind of a behavioral inhibition, that kind of temperamental traits, and you can identify them at a young age, and you work with the parents, not saying the parents aren't doing anything wrong, but work with them to help foster some risk-taking, to be supportive and not being, you know, not facilitating their anxiety. You can make a big difference down the road working with the kids at a young age if you can identify kind of kids maybe at risk for anxiety.
Are there books or something that somebody, a reference that somebody could go on that? I think that makes a lot of sense to me. How do you help your child develop past the fears and take some risks so that life has some color to it?
Right, and you know, the American Academy of Child Psychiatry and even the American Academy of Pediatric websites have some either links or some resources on just kind of helping foster, helping your kids. And frankly, if you're an anxious parent, I would argue that, or you know, anxious or depressed parent, make sure you're dealing with your, you know, just for your own, you know, for your own benefit and health, deal with your anxiety, but it's also going to help your child immensely.
There was a study about mama being unhappy, then the kids become unhappy, and so when mama's happy, everybody seems to be happy. Right. Well, I mean, not blaming mama, it's the parents. Right. So, I mean, if you have parents that are getting along, I read one parenting book that said, if the mom and dad love each other, all the rest follows. If they get along, or if they have a happy environment at home, that resolves a lot of things. You agree?
I would agree. I
would agree, and we're cautious not to assign blame. And
no, and it's not a blame. In fact,
but we are talking about if you need motivation to go get help, there's great motivation.
There it is.
Because if you can't do it for yourself, do it for your kids, do it for the family. As you said, if they have anxiety and depression going on, go and seek help.
Do it for yourself, but also do it for your kids.
For your kids.
But the one study I was talking about was actually the parents were doing a good job. It's just identifying these inhibited kids and then helping them kind of support them as they try to journey out, because they're going to need a little bit more shove than the aggressive kid who likes, you know, new things.
All right, 10-second bottom line. Matt?
Well, anxiety is very prevalent, but there are a lot of ways that you can address it, and it shouldn't be making you ineffective in your relationships, your life, your work. Get some treatment.
Great.
I'd say anxiety is a normal phenomenon, and everyone, it can be helpful, but at higher levels, it becomes a problem. And I think if you can help, the younger you identify it, the quicker you help a child, the better prognosis.
Great, thanks. We'll be right back after this.
When you quit smoking, you get extra cash in your pocket right away.
Yeah.
1 month and you've got $150 extra bucks you didn't have before. Quit 6 months and you have an extra $1,000.
Oh.
$2,000 in a year, $4,000 over 2 years, and a whopping $10,000 in 5 years. Nice chunk of change. So take a deep breath. You can do this. We can help.
Was FDR right when he spoke to the danger of fear itself? Experts explain that when we're threatened by real danger, an area of our brains called the amygdala goes into action to help us survive. The amygdala stimulates the adrenal gland to release adrenaline, which in turn prepares us to defend ourselves or to run, the so-called fight or flight system. Adrenaline causes heart racing, sweating, blood flow to muscles, preparing us from an attacking enemy. Fear was designed to help us survive. But fear does not always help us avoid danger. During my medical school rotation on the psych ward, I observed people with paranoid schizophrenia, an emotional brain illness manifested by an inappropriate and overwhelming fear that others were plotting against them. These patients had lost touch with reality and had bizarre thoughts, all resulting from a neurochemical imbalance that is really still not perfectly understood. But what stuck in my med student brain was how their deep-seated and overwhelming fear was somehow connected to such severe mental illness. Fear appeared to destroy them. Well, most of us have minor inappropriate fears resulting from small, past minor emotional traumas such as going near water, seeing the doctor, flying in airplanes, walking near swooping birds, speaking in public, and the list goes on. Trouble comes when a fear keeps us from functioning normally, thus making it a phobia. Something similar to life-interfering phobias is post-traumatic stress disorder, or PTSD. This results as a consequence of specific, severe emotional trauma and an overwhelming panic-like adrenaline surge when the person is reminded of that bad experience. Presently, we live in a not-so-dangerous world, quite different than from our great ancestors. Now, although there are times when we need that adrenaline surge, we're generally more in danger of harm from fear itself, like in those with paranoid schizophrenia, or phobias, or PTSD. Most of the time, we can better sidestep that, what can hurt us, in a rational and cool way by identifying, avoiding, and/or dealing with danger without paralyzing panic. Antipsychotic medicine is unquestionably the best and mainstay treatment for schizophrenia, and PTSD needs its special meds and counseling. But for simple phobias, I prefer antidepressant over anti-anxiety, Valium-like medicines. And when appropriate, advise psychologists armed with programs to help us gradually face and practice and overcome inappropriate fears. Just the right amount of fear can save us from an enemy, but fear itself can be very bad. Well, this brings us to the end of our show this evening. I sincerely thank our fantastic guests tonight, David Ermer and Matthew Stanley. We've looked into some dark and scary places tonight, but there are those who have found ways to use even this pain to push creativity. Norwegian artist Edvard Munch felt that without anxiety and illness, I should have been like a ship without a rudder. And from all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
Additional funding is provided by
Aberdeen Asthma and Allergy,
Brookings Health System,
Dakota Allergy and Asthma,
Dakota Care,
Dakota Dermatology,
the Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
and Swiftel Communications.
Closed captioning for On Call with the Prairie Doc is provided by the generous support of
Avera, Brookings Health System,
and Fishback Financial Corporation.